Hi, welcome to Culture and Causation. I'm Aaron Briley, and I'm pleased to introduce my guest today, Dr. Paul Hastings. Dr. Hastings is a developmental psychologist and a professor of psychology at the University of California, Davis. His research is focused on looking at the factors that influence the development of our mental health. Dr. Hastings received his BA from McGill University, his MA from the University of Toronto, and his PhD in applied developmental psychology from the University of Toronto. I first heard of Dr. Hastings from an article he published called Growing Up in Poverty Increases the Risk of Developing Psychosis Spectrum Disorders in Adulthood. There he discusses the connection between growing up in poverty and the mental health of children. So I'd like to discuss this article and more on today's show. Now, that concludes my introduction. Dr. Hastings, welcome to the show.
Thank you. Nice
Great.
to meet you, Aaron.
It's a pleasure. Now, I'm interested in your work on the relationship between poverty and mental health of children. But first, can you describe what led you into this field?
So I did my undergraduate studies at McGill University, as you mentioned, and I didn't initially plan to go into psychology. I was sort of in a general science and pre-med kind of stream. And then I took my first psychology course and I was hooked, and it changed my entire program. And really resonated with perspectives of developmental psychology, which is trying to understand not just what infants and children and adolescents are like, but why they engage in the patterns of thinking and feeling and behaving that they do, what contributes to those patterns, how those patterns change over time, and how they really set up the people we become as adults. And to a certain extent, to understand our functioning as adult humans, we need to start at the beginning and look at that progression across life. And that's what I set out to do with my course of research, where I first spent my graduate studies really focusing on family processes and parent-child relationships and understanding what goes on within the home. And then as I expanded that sphere of research in my subsequent studies, I started to incorporate more neurobiological measurements and examinations of physiological processes and how they get shaped by family interactions, by parental socialization, and by the social and cultural contexts that families live in. When I took my first faculty position at Concordia University in Montreal, I then was introduced to Alex Schwartzman, who, along with Jane Lenningham, was one of the founders of the Concordia Longitudinal Risk Project, which was a study that started in the 1970s with approximately 4,000 children and their families in urban Montreal. And in talking with Alex about his goals for this study, it really was to understand what predicts the emergence of schizophrenia over the lifespan. And we got really excited talking about what could be done by going back into that original database and working with provincial and federal systems of archival data for health records and census records and things like that we could pull together to look, okay, let's take a really big picture view of what was going on over the course of the development of these children into adulthood, to see if we can identify factors in their lives that would predict to the emergence of schizophrenia. And that's what led to this paper. The participants in this study were Francophone children living in lower income neighborhoods in Montreal in the late 1970s. And we used provincial health records and national census data to look at their health and their neighborhood conditions over the next 30 years of their lives.
Now, in this article, so you describe how growing up in poverty, increases one's risk of developing psychosis spectrum disorders in adulthood. And now, is this specifically schizophrenia, or were you looking at other types of psychosis spectrum disorders?
We looked at a range of psychosis spectrum disorders, including schizophrenia, bipolar disorder with psychosis, other psychosis spectrum disorders like depression with psychosis, and also psychiatric problems without psychosis. In part, we wanted to be able to predict to or identify what would predict to disorders with psychotic symptoms specifically. And so we also needed to identify the presence of other psychiatric disorders within the sample without psychosis, so we could make that distinction. Poverty is a risk factor for most forms of mental health problems, just about, as is also the case with most forms of physical health problems. The adversities of growing up in poverty, including the chronic perpetual stresses on the parents and family, the extent to which those stresses disrupt the family's ability to maintain harmonious, supportive, positively engaged relationships, the uncertainty about housing conditions, about potentially frequently needing to move or being required to live in unsafe or damaged spaces, the unpredictability of food, the greater exposure to toxins in the environment. Poverty is a multiply threatening context for healthy family functioning and healthy child development. And not surprisingly, it's associated with most forms of mental and physical health problems. It is a pervasive stressor that disrupts all normative adaptive forms of support for healthy functioning and development. And there are families who, for their own resources, their own competencies and strengths, or their availability of support networks, are able to overcome those adversities and show resilience. But that's very challenging and very difficult, and it puts a big burden on parents or families to suggest that, well, you potentially could cope with these situations, therefore it's on you to do so. The fact that there's greater exposure to toxins, the fact that there's greater exposure to risk of crime, the fact that there's lack of availability of community resources, of effective schooling, of predictability in people's lives, is something that is beyond the control of any given parent or family. These are social and systemic contexts that are imposed upon people who are living in poverty. And trying to tease apart which one of those things might be contributing to pathways of poor health or maladaptive development is really, really challenging, and is perhaps missing the point that the cumulative effect of all of these diverse impacts of stressors are eroding so many aspects of normally adaptive expected functioning that it might be the total burden of poverty rather than any one element that matters.
I see.
Moving people out of poverty conditions improves health. So as we talk about the research, our study was not an experimental study that is the kind that can identify a clear cause and effect association between poverty and health outcomes. But there are other studies that have been experimental studies, and there are current studies ongoing about providing families with resources through lottery systems or gift cards or monthly credit cards. And also a classic study, the Moving to Opportunity study, in which families were, again, in a lottery system, given the opportunity to move out of their impoverished neighborhood conditions and into a more economically secure neighborhood conditions without changing family income. And what has been found is that the physical and mental health of those families improved, and particularly improved for the younger children within those families, for whom moving out of poverty happened earlier in life. So that is causal evidence that improving the economic context within which families are living improves the well-being of children's development.
Well, that's fascinating. And can you speak more about some of the physiological problems that are correlated with this? Because I believe your research, you're not just looking at how certain stressors can affect someone's mind, but you're also looking at, I think, how these stressors can really affect their physiology. They can affect their nervous system. Is that right?
Yes. One of the assumptions of the paper that we wrote, and something that we're actually testing in other studies and that other research groups are testing as well, is that there's a process called biological embedding, or another phrase for that is stress getting under the skin, that the life context that people are living within influence the development of their neurobiological regulatory systems, their brain, their bodies, their hormones, pretty much all systems that are involved in the regulation of healthy biological functioning. Our minds and our brains and our bodies are one thing, and we experience the world and we interact with the world through our minds, through our consciousness and our subconscious processes. But those are inextricably rooted within our biological systems. And what's been shown in a number of studies is that growing up in poverty and the more time spent in poverty over the course of development shapes the nature of the functioning of the brain and the body, both with regard to the activity of neural systems and hormonal systems and the immune system, but even to the point of the structural organization of the brain and of bodily systems, such that spending more time in poverty over the course of childhood and adolescence, in effect, is leading to, on the one hand, aspects of programming the body for a poverty context, such that the body is trying to adapt to that context and organize its systems and its functioning to try to survive within that context. And on the other hand, through the exposures to stressors and to toxins, et cetera, just undermining and eroding healthy functioning of those systems. So rather than purely from an adaptive framework, it's also from a damaging framework of what's going on with that. The assumption then being that these bodily systems that have been altered or disrupted or damaged contribute to poor health, both mental health and physical health.
And these issues can last not just throughout childhood, but this can last, I mean, years later or decades later. I mean, that's...
Yes, we've looked at this principally in our more behavioral studies, like looking at symptoms of mental health problems. We've looked at it extending into people's 40s, from childhood exposure into middle adulthood, with our own studies of the development of neurobiological systems in adolescence. We've looked at it within the first couple of decades of life. And we see it with exposure to poverty in early adolescence, predicting brain activity, hormonal, immunological, metabolic activity in late adolescence. And then there are other research teams who have done this over various time spans that are showing links between childhood and adolescent exposure to poverty and adult health conditions 10, 15, 20 years later. So again, going up into middle adulthood.
Well, I mean, I think this is truly amazing research. You know, I don't hear much of this in the mainstream media. I don't read much about how poverty can have such deep and lasting effects. I think it's generally understood by most lay people that, well, once you're out of poverty, things can change. You can just think differently and you should be okay. Where here you're saying, no, it really affects us at our deepest level. And that's really interesting.
It does, and it does so in sometimes some unexpected ways. There are aspects by which getting out of poverty itself doesn't always ameliorate all the difficulties. I think one of the most striking lines of research that's emerged in recent years has come from Jean Brody, working in rural Georgia with rural African-American impoverished families. And in collaborating with researchers from Northwestern University, Greg Miller and Edith Chen, they've been looking at how poverty exposure, but also getting out of poverty, is associated with adult functioning. And one of the things they have found is that adolescents who have what is usually thought of as a form of resilience, very good self-control, very good ability to regulate their thoughts, emotions, and behaviors, they're more likely to succeed in school and to go on to college and to get out of poverty. Yet that high level of self-control in adolescence within African-American rural youth who are exposed to poverty or raised in poverty predicts a pattern of physiological activity called metabolic syndrome in adulthood, which is disruptions to numerous neurobiological systems that create greater risk for things like cardiovascular disease, obesity, and diabetes. And it's almost as if the mental and cognitive effort that goes into overcoming the stresses of poverty in adolescence takes a physiological toll on the body, and moving out of poverty doesn't erase that toll. It is a very new line of work. In fact, I would encourage you to reach out to them and discuss this with them. But it's something that they have called skin deep resilience, where we can look resilient to adversity, and we can look like we've overcome adversity by progressing on to more positive developmental trajectories and positive life outcomes. But that doesn't mean that those good outcomes come without a cost. And the cost can often be hidden and exist below the skin, and then get manifested with future health difficulties.
So if parents are raising children in poverty, is there anything they can do to mitigate these problems, these potential problems?
There are. It's been shown in multiple studies that parents who are able to manage their own stress to the point where they're able to stay positively engaged with their children, to provide support for their children, to be attentive to their children's emotional and social needs and cognitive needs, to avoid being highly punitive, highly angry and critical of their children, to provide structure, to do the job of a parent in terms of guidelines and organizations and expectations and structure for the child, but at the same time to be sensitive and responsive to the child's needs, and to be attuned to the child's wishes, the child's distress, to respond with supportive behaviors rather than critical behaviors when the child does experience distress or shows need of some kind. That actually really does help to buffer children against both physiological and mental health consequences of poverty. At the same time, though, I would say that continues to place a lot of the burden on individuals to be able to cope with those kinds of challenges and to overcome the incredible burden that's placed upon the shoulders of parents in poverty. And addressing things from a more structural or systemic framework of how do we change contexts of poverty for communities, I think has the potential to benefit a greater number of people who experience this risk than to try and say, okay, how can we try and foster individual parents' abilities to cope and maintain a pattern of positive parenting?
What does a supportive peer group play in minimizing the damaging effects of poverty? So the peer group of the children, and can this help even more than parents can? There
There are signs that a supportive peer group in childhood and adolescence may help individuals experiencing poverty to follow more positive paths of growth. To be honest, I'm not familiar of work in that area that has looked at the extent to which peer support or a positive peer network buffers the physiological aspects of the impacts of poverty. It's possible that work is out there and I'm unfamiliar with it, but I haven't read studies that have tried to integrate an examination of peer processes in childhood and adolescence, specifically within impoverished communities, with neurobiological development. But there's good evidence that having both a supportive peer network, but potentially even more importantly, some good, close, trusted friends, deeper relationships, can protect against mental health problems and promote greater well-being, life satisfaction, self-esteem in adolescents and young adults.
Now, back to the policies. So are there any specific policies that you support that would improve the mental health outcome of children growing up in poverty? I mean, you mentioned, we briefly just touched on that a second ago, but are there any specific things that you think could help?
Well, there are existing aspects of the social safety network that are absolutely critical for providing for the basic needs of families experiencing poverty. WIC, Women, Infants, and Children, SNAP, the Supplemental Nutrition, the Earned Income Tax Credit, EITC. All of these are programs that are designed to provide economic and nutritional support for lower income families with young children. And they're often under pressure at federal or state levels to, depending on the program you're talking about, to try and reduce those expenses. But it's evident that those are critical for providing the basic foundations of meeting needs. So the extent to which those kinds of programs that are meeting the absolutely critical foundational needs of nutrition and sufficient income to try and maintain stable housing need to be supported, need to be expanded, in my opinion, and extended also with regard to the age range of children that are being considered. A lot of these things focus on infancy, or is it 0 to 3 or 0 to 5 year period. But we know that the susceptibility to the impacts of poverty on well-being extend well beyond the early childhood years. And adolescence itself is a period of massive neurobiological reorganization. Anyone who's gone through puberty can remember your body goes through a lot of changes over a short period of time. And anytime your body is going through rapid neurobiological change, it is potentially more plastic and open to influence. And if you're in a situation of depleted resources or high threat or stress due to unpredictability of the availability of resources, that can disrupt the maturation of the neurobiological systems. So extending the availability of these basic social support plans to communities who are at economic risk and extending the ages of eligibility for children in those families, I think, are very important for trying to address this. Another element that is really important that we haven't talked a lot about is the availability of good school systems, of well-functioning, well-funded schools that provide that kind of external support. It doesn't all rest on the family. There needs to be that kind of community connection and that kind of educational opportunity for youth to feel connected to school, to be motivated to engage with school, and for the school to provide them with the kinds of education and extracurricular resources necessary to scaffold their future success. So continued investment or expanded investment in public school education is, I think, a really important element of this. Potentially another line that would be a little bit different from what tends to go on at the federal level, and something that is, I think, a little bit more of a more often a state or municipal focus, is investing in the structural resources, both the physical structural resources and the social structural resources of neighborhoods, of establishing shared community resources, community centers, places where children and families can aggregate and engage in positive, mutually supportive experiences. That decreases stress and it increases learning opportunities in non-formal settings outside of school. It tends to lead to greater investment of people in their community, such that they are less likely to kind of either withdraw or give up on their neighborhood situations, and instead try and improve. As they see investment coming in, as they see neighborhood improving, they in turn invest on furthering that. So it can reduce crime rates, it can reduce drug use rates, it can increase the likelihood that families will feel like they are in a context within which they have the potential to thrive and do well.
Well, I think we're out of time. So Dr. Hastings, thank you for taking the time to speak with me. I really appreciate it.
It was great to talk to you, Aaron, and I hope this has been helpful. And if you feel like you'd like to follow up on anything, certainly let me know.
Great. Thank you so much.